Good afternoon, everybody. I'm Dawn Genvy, and I'm a research manager in the Patient and Public Involvement team at NIHR. Welcome to the 6th in our PPI in Action webinar series. Today's presentation is focused on embedding co-design and co-production to support refugees' mental health. Before the presentation, I'm just going to very quickly run through some housekeeping rules. Next slide, please. Please use the chat function if you would like to network with others on the webinar. Please do not use the chat for questions. You can enable captions by clicking on the CC button. And next slide, please. And if you would like to ask a question, please use the Q&A function by clicking on the Q&A button. You can select to send anonymously if you do not want your name associated with your question. Once you've finished, remember to click send to submit your question. We've got a Q&A at the end where we'll answer any of the questions that have been posted. Without further ado, I'm delighted to now hand you over to Dr. Helen Lloyd.
Thanks, Dawn. Welcome, everybody. It's a pleasure to be here. I'm here with members of my team to talk to you about the Roots to Wellness project. So the Roots to Wellness project is an NIHR-funded programme of research to design and develop a peer support model for refugees in the community to improve their mental well-being. It's a mixed method study over 3 phases. We'll go into a bit more detail about that later. But essentially, we've used experience-based co-design to design our peer support model and to test it in a feasibility trial. As you can see from the slide that you're just looking at, this project has been a very big collaborative effort. We've had exciting and engaging contributions from a range of different higher education institutions across the UK and some really important NGOs working with refugees in the community in Plymouth and Gloucester. Before I move on to going into a little bit more detail about the project, I just want to linger for a while on this beautiful picture that you can see on this slide. Very early on in the days of the project, once we got the funding through, we engaged in a creative workshop with refugee and asylum seekers in the community in Plymouth, where we took to them this idea of the project Roots to Wellness, and we asked them to create a piece of artwork which would symbolise what they thought Roots to Wellness might be, and the meaning they associated with it once we'd introduced them to the project. So this picture in front of you, you can see, is I think very symbolic of the project. It represents hope, and the hope that people can integrate and improve and engage in post-traumatic resilience and rebuilding to improve their mental health with the right kind of support from services. And the young woman you can see in the boat is making her journey to safety to Plymouth, which is symbolised by Smeaton's Tower, which is the lighthouse, a very recognisable emblem of Plymouth in the southwest. And you can see the hole in the woman's chest, which represents loss, which is often something that we hear, that we know symbolises the refugee journey. But importantly, you can see that through the woman's chest there is a growth, symbolised by the branch, and a small robin, which is a bird that this person was exposed to when she arrived in the UK, which she had no prior knowledge of. And so for her, the Roots to Wellness project symbolises hope and a journey, and we hope we're going to take you through that journey with us today to show you how important experience-based co-design and lived experience has been woven through our project. Before we start, I just want to cover this definition of what we mean when we talk about a refugee. This is the Refugee Convention's definition of what it means to be a refugee. So this is someone who is unable or unwilling to return to their country of origin owing to well-founded fear of persecution based on race, religion, nationality, or membership to a particular group or political party. We've now seen, given the devastation of war across the globe and climate crisis, that these drivers are now forcing people to flee their countries of origins and their homes. And in the first half of 2023, we've seen the UK as a country of refuge for around 170,000 forced migrants, a number which is increasing rapidly. as we speak. As I mentioned, this was a collaborative project. We had experienced professionals in methodology, so experience-based co-design in Glenn Robert. We had people who work supporting refugee and asylum seekers in the community through LiveWell, which is our mental health provider. We had people with lived experience who were really core to that kind of oversight of the project, professionals in the psychological space, and people who work with NGOs. So this was very much a collaborative effort, and you'll see that as we progress through this presentation. But our core team, people who have been with us from the beginning, are not all presented here. And so I want to offer thanks for all of our kind of wider collaborators, but it's particularly the core team. Deborah and Kristen, who are not with us today, began the conversations for this project through funding through the National ARC, where we met with people in the community to understand priority areas for refugee and asylum seekers. It was back in 2017 when those conversations began, and it wasn't until early 2021 and 2022 when we were funded. So the engagement started before we were funded, and the reason why we feel that we've successfully applied for funding and contributed something that is really of need to the community is because that prioritisation came from the community themselves. So now I'm going to share with you a slide just to example how people with lived experience have been engaged at different levels and interfaces throughout this project. So first off, we have an involvement group, which is led by Kristen Yalbo at Exeter University. So this is people with lived experience, some of whom are here today, who have been there as a reference group that we've gone back to continually to get us to think about our language, our methods, our processes of engagement, the sort of findings and the arrangement of engagement throughout the project. So that's been a core aspect of the project through the 4 years. We have, as many NIHR funded projects, a national steering group and an advisory group which has people with lived experience along with the researchers and some providers. We have a local reference group both in Plymouth and in Gloucester. This is made up with people with lived experience, providers and also academics. And this is to exchange knowledge between what's going on in the policy, provider landscape, the community, with what's going on in the university and the project and vice versa. And then we have, of course, the main research team, which is our research fellows. We have a peer researcher, which is somebody with lived experience. Amani has been providing that role for us and is with us today. And we have research assistants and a peer researcher. We have the core study team, which is most of the people that you can see here today. And we have core study team that have been working across Plymouth and Gloucester. Within that, we have service providers who are delivering services through the NGO space and also statutory providers. But what's been really core to experience-based co-design is the fact that over the second phase of the project, which Hoayda will go into in a bit more detail later, we brought together people with lived experience from a range of ethnic and linguistic and cultural backgrounds to help us design the peer support model, which we then tested. So we've had engagement throughout the project at a number of levels and a number of interfaces. And very early on in the project, we came together to decide, how we were going to operate in this space, working through philosophical principles which we know are really core to participatory methods. But we wanted to make sure that these principles were enacted across all the kind of engagement that that was really core to the project, to get the project off the ground and making it successful. The building of the trust 6 months before we actually began any data collection, and then the co-design and then the feasibility test. So we work from this principle of personhood, recognising that to be a functioning person that's supported and thriving, people's strengths and capabilities need to be recognised, and that's really core to the peer support model, but it's also core to all the engagement that we've conducted throughout the project. We view societies as storehouses of capabilities and resources, so that we try to share and distribute power in all that we do through the project. and that person-centred care is a way of being, it's existential, and it's something that we have to engage in and constantly reflect on to make sure that we're living the values that we are espousing. So we think about social capital as essential for health and well-being. So this is being socially connected and valued and listened to and having purposeful roles in society. And that we recognise that there are structural presence of network of access to people and resources that can be drawn upon. We see cognitive resources, shared representations and interpretations, and systems of meaning that can differ between people that we engage in because they come from such varied backgrounds, linguistic, cultural, religious backgrounds. And that people differ in terms of their relational understanding, their social norms, and that trust and trustworthiness is something that has to be underpinned and enacted throughout the whole of the programme. So we tried to make sure that we delivered and that we reflected and that we enacted these principles throughout the project. So the research questions that we attempted to answer, I won't go through each of them individually, but we wanted to really understand how refugee and asylum seekers conceptualise, express and experience mental distress, and how they relate this and express this in terms of a whole range of different domains. We wanted to ascertain if it was possible to co-design a peer support work model that was acceptable to refugees and asylum seekers, but also the services with whom we engaged with. We wanted to understand if there was benefit that was derived from the model and who the benefits were most likely to be achieved. We wanted to understand if there were any unanticipated outcomes associated with the model and whether there were any disbenefits or challenges that could be improved. So we were looking very much at the facilitators and the barriers to delivering this kind of work, because it's very novel. Peer support work hasn't been tested robustly in the UK for refugee and asylum seekers up until this project. So we also wanted to understand what was a trauma-informed and sensitive way to understand where their benefits were for refugee and asylum seekers. So we co-designed an evaluation framework with people with lived experience in order to help us answer that question specifically. Before I hand over to Hoayda to talk in a bit more detail about the project, I just want to go through a quick overview about what it means to be doing an experience-based co-design project. Experience-based co-design projects have been used really successfully across the NHS to improve services in neck cancer and a whole range of different mental health interventions. But they're typically used for interventions that are already underway or services that are already happening. So we applied this methodology to a completely novel space to develop something new. And the reason why we chose experience-based co-design is because it matched the principles by which we wanted to work. It relies on participatory, equitable relationships in order to achieve meaningful change based on people's experiences. So to do that, to take service users and patient experiences and understand the nature of the problem using narrative, you can then derive these really important stories which can drive through the change or the development that you're seeking to achieve. So it has a transformative element. It's based on equity and values of equity across everybody that takes part. And because it's based on narrative data, it has the catalyst potential to really change the mindsets, the behaviours, and the thinking and behaviour of people that are involved in service delivery. So we felt that it matched our principles and the aims of the project. And you maintain the focus of these through a stringent adherence to the steps, paying particular attention to the context of which the data is provided. So that's a bit of a kind of whistle-stop tour and what it means to be doing experience-based co-design. But the most important things to take away is that it's based on narrative and it's about changing behaviour. And because it's based on equity, it means that you can work in a way with people that crushes the hierarchy and creates more egalitarian space, valuing the different knowledges that space can surface. So I'm going to hand over to Hoayda now, who's going to go into a little bit more detail about the experience-based co-design project and the project as a whole. Thank you.
Thank you, Helen. Hello, everyone. As Helen mentioned, I will be taking you through our journey in the Roots to Wellness project. Our project, there were 3 phases in our project, starting with phase 1. Once we got the ethics approval, we started data collection where we gathered information, learning about how people expressed their mental health issues, how they talked about mental health. We spoke to people from different backgrounds, with refugees and asylum seekers in the 2 sites of the study, where we had one-to-one interviews and focus groups with refugees and asylum seekers, and focus groups with service providers in the 2 cities of Plymouth and Gloucester. Then we moved from phase 1 to phase 2, which is the co-design stage of the project, and the phase 3, where we implemented the peer support model that was co-created, co-designed in phase 1 and phase 2. So in phase 1, this is just a taste of the results we had in Plymouth. We transcribed and translated the data, the interviews and the focus groups that we had, and we found certain themes. Basically, to name few, the majority was around the hostile environment and the effect on people and their mental health. The focus on the physical health by the majority of participants and their experience with health services. We also, as you see, we highlighted the touch points, which are the critical points that creates big emotions, good or bad, in the people's experience. Then we took the touch points that we collected in phase 1, and we started the co-design in phase 2. In phase 2, we had a series of workshops. In total, we had around 8 workshops in both sites. I started in Plymouth a little bit earlier than Gloucester. We met with public contributors before we started the workshops, where we talked about what we mean by data, what we mean by data analysis, and the words and the ideas we use in the project, and how best to share these information and present in the workshops. And we took their feedback and their input into the design of the following workshops. We started our first workshop to establish and find a common language amongst all the contributors in these workshops that contained academics, people with lived experience with forced displacement, and also service providers. In an average, we had 11 people with lived experience and 5 service providers in one workshops. In the first workshops, we presented the data from phase 1, as I said, as touch points in 2 forms, on cards that contain texts, and in images that represented these touch points. And we tried to find if these touch points represented similar themes as we understood from the phase 1 to the contributors in the workshop 1. We moved to workshop 2, where we looked into the mechanism of how people made their decision around accessing services, not accessing services, talking about their mental health, not talking about their mental health. And that was introduced in a creative activities during these workshops, where we had the touch points put in a sense of if, then, because, and we asked the contributors to line these together to clarify the mechanism behind making these decisions. The workshop also, in the second half of the workshop, there was a talk about how could a peer support worker help, and the participants worked around the characteristics of the peer support worker. In the following workshop, we continued on in looking at how a peer support worker could help. And this time we took, the research team took the data from phase 1, the touch points, and we rewrote the stories and created scenarios in a shape of a vignette. Our team members and volunteers sat and read these scenarios in different groups. And the contributors work like directors. So while the acting, I would say, or the volunteer from the team were playing the role of a refugee who's receiving support, and the other the role of a peer support worker who is providing the support. They were reading the transcript, being videoed, and the contributors were watching behind the camera and intervening, saying how a peer support worker should and shouldn't act in that situation. We took the information together and we started building the model. The model started to shape, but now we are talking about, sorry, no one is clicking the slides, I think. So we are now on slide 17. Thank you very much. In workshop 4, we continued looking into how a peer support worker how to become a peer support worker. So we went through the training that needed, the CV, the legality, who can apply for the position and who can't, what are the characteristics, building on what we found earlier in the workshop, and what type of experience and qualities required from the peer support worker. We talked also about the supervision and mentoring that are needed to support the peer support worker. We moved later in workshop 5 to look into the tools and the toolkit that needed for the peer support worker, and the findings of this workshop were around the importance of personal interaction, face-to-face interaction, but also recommended the need for an app that we actually developed a prototype with a techno team in the University of Plymouth. That app is aimed to help and support the peer support worker, providing an easy access and direct access to services, to information, to records, etc. And this app is still in development. In workshop 6, we looked into evaluation of the work of the peer support worker. How is it better? What are the acceptable terms and talks and methods and modality of the evaluation for the work of the peer support worker. In that workshop, contributors looked into different questionnaires that already used and existed. For example, we looked at the Web's short version and the brief resilience scale. We looked into the challenge sense of belonging scale, the self-stigma of psychology help, and others. And we went through these questionnaires and we presented them in different modalities, and the participants ranked them using medal kind of system. And eventually we found out that also, again, face-to-face interaction is much preferred. And there was some recommendations around the language. After that, we took the input of these workshops and we started the phase 3, where we recruited 6 peer support workers. Now, in the recruitment procedure, we took the outcome of the workshops where a person with lived experience was sat on the panel of these interviews, job interviews, where the people applied to a job description, according to a job description for peer support worker that was built according to the findings of the workshops. And also there was part of the job interview where we had volunteers of people with lived experience acted as people who are receiving the support, and also observed the way people or candidates interacted with them. So we had public contributors contributing to the selection of the peer support workers. And in phase 3, we started actually supporting people and recruiting people, started receiving referrals from NGOs for people to receive support from our amazing 6 peer support workers, 3 in Plymouth and 3 in Gloucester. Now we are at the end of the phase 3. We still have a couple of months in Gloucester, but we finished phase 3 in Plymouth. And we are looking at the outcome of our evaluation, where we had people who received the support fill in questionnaires, and we had some qualitative evaluation conversation with them. And so far we see the impact that the peer support work has had so far. These are the initial findings, where we noticed there's an increase in social connections and reduction in stigma of discussing mental health, reduced perception of isolation, and appropriate use of services. We have this lovely, cute quotes from one of our public contributors and actually a participant in our workshops. She said, most people in our home country don't give much notice to mental health, so we are not used to talk about our pain and problems. So now I feel like I want to correct this, to tell everyone to talk, to express how they feel and experience. That is what changed in me, frankly. This is when she was asked how being part of this project helped her. And also we have similar feedback from people who actually received the support from our peer support workers. I would like to move now to introduce you to one of amazing public contributors, Shala, who has been involved in the project from the very, very start and been with us since then.
Hello, my involvement with the project Wellness began in 2022, when I first met Kristen, and we discussed the aim of the project. At the time, I was an asylum seeker and a volunteer with Devon and Cornwall Refugee Support. When I received the project proposal, the title was Forced to Wellness, and I felt uncomfortable with the wording, and suggested changing the name to something more positive and empowering, to help encourage greater community engagement with the Roots to Wellness project. I also gave feedback on other aspects of the content. Later, I became more effectively involved in the project while I was a volunteer at the DCRS Art Club. I designed the logo, as you can see, for this project. I also participated in all the workshops that Hoayda mentioned, and helped to create the training for the peer support workers. And I then spent a couple of months working as a peer support worker myself. And then I tried to be positively helped to the project. And later I also helped with designing the app that Hoayda mentioned. And still I'm always available when they ask me for any help or anything. And then, yeah, that's all about me, how I contribute with this project.
Thanks, Shala. I just want to correct, it was Forced to Flee, the original title.
Yes, it was Forced to Flee that.
But thank you so much.
Yeah, I think now it's Wen-Yu.
Next. Yeah, thank you, Hoayda and Shahla. So in between these workshops and throughout the project, we've had lots of meetings and informal conversations and visits to local services, which allowed us to make spaces for ideas and also for taking up those ideas. The ideas and knowledge that is grounded in lived experience, and sensitive to the local context and sensitive to the circumstances, as you know, that we then have been updated by the services about the challenges they face, and the constant difficult circumstances they are facing. So these visits and meetings are not only help us to build relationship, but also allow us to look what's already there. So what are the resources that are already there, and what are the talents that is already here around us? And that lead us to an art and logo workshop. That also informal conversation led us to develop the guideline for working with the interpreters, and also a peer support worker training that's open to public, which was, all this is not planned in the initial project, so it's emerged throughout the process, through the contributions of people who've been working with us, and one of the highlights, I think, so this engagement activity is the celebration event. And I think what I've learned from organizing the events is that it's such a great avenue to allow people to contribute and to open for contributions, and it injects so much energies and joy into the projects. And we've had a group dance, we've organized a group dance, we've had the Roots to Wellness playlist, we've done crochet, and all sorts of different activities. We have contributor who baked a cake with our logo on it, and we taste a lot of amazing different food. And one of the highlights also, there's a testimonial video that comes from the ideas of public contributors while we were preparing for a celebration event. And you can find this in the Roots Wellness website. The testimonial video is also highlight the impact of people's participation in the workshops. And we have a peer researcher who is with us today, Amani, and she's done a lot of engagement work with the local services that it's a bit further away from us. And she's also done a lot of translation, so not in terms of language, but also the language of academic language to the language that's easily understood and digestible for people who've been working with us. And all these would not be possible without adequate resources and funding. So we make sure that we pay for contribution and childcare, and meanwhile also be aware of the payment that might bring negative impact. And that will bring me to ethics. So next slide. So we've had ethics governance, which is the basic, but then from the very beginning, we've developed guiding principles, because we recognize that the particular challenges working with people experiencing forced migration, they are legal precariousness, and increased criminalizations of migration. There's also the unbalanced or unequal power relationships that we sort of tiptoeing and constantly reflecting upon. And we've also through the guide, so throughout this process, we make sure that we don't ask certain questions, and we are quite sensitive while we're dealing with paperwork, consent signature, films or photographs. So all the while being sensible and careful, all the while understanding that we will never be able to fully understand other people's experiences without the others. So not to assume that people with lived experience of forced migration are by default more vulnerable or by default fragile, but it's the the circumstances that's fragile and vulnerable, not the person. And so throughout the project, we did a lot of reflection sessions, and we help each other to think through a decision and collect ideas and make spaces for them. And next slide. And so, of course, there are different challenges in terms of temporalities between, the institution, university institution, and services on the ground, and university requirements and context, ethics and care, and how to sustain a regular and continuous involvement, and also the different ways of communicating research and data. And we can come to these can be in a discussion if it's not already emerged later. Thank you. I'll hand over to Megan.
Sorry. Hello, welcome to this part of the presentation called Bridging the Gap Co-Production in Refugee Research. I'm Meg Stuart-Richards, a trainee clinical psychologist, and I'll just hand over to Ganel, my co-researcher, to introduce herself.
Hello everyone, and I was involved in this project 2 years ago, and I was peer support worker the last 9 months. Also, I worked with Megan. I don't know how many years, but I think quite long time.
Yeah, about 4
Yeah.
years now.
Yes.
Yeah.
Yes, and we sometimes meet online, we discuss things, and I'd like to say you thank you for inviting me today. It was very easy to work with you, and however, English is my fifth language. I could understand all content you sent me, and yeah, we sometimes meet online, we discuss things, we change also edit sometimes, and because Megan was very open-minded, and it was easy for me to work with her, and yeah, everything was clear for me. Thank you.
Oh, wonderful. Thank you so much, Ganel, for sharing some of your experience on working together. So this project was developed from the wider Roots to Wellness project and forms part of my clinical doctorate in psychology training. So Ganel is one of the 3 co-researchers who identified as having refugee status, who kindly agreed to work with me as a paid co-researcher through every part of the project. Next slide, please. Sorry, do you mind going back one slide? So this we'll start by taking you through how we embedded meaningful co-production throughout each stage. So we started off thinking about the aim and methodology we could take to approach action-based research around refugee mental health. We decided to turn the researching microscope to refugees researching trainee clinical psychologists' learning needs, as they hold quite a bit of power within mental health service provision. We first co-created a survey to scope current trainee clinical psychologist learning needs, and here co-researchers were really helpful in helping me to overcome a blind spot here, because I'd taken quite a critical negative approach in writing some of the questions of the survey, whereas the co-researchers added some solution focused questions around what was already going well in services which could be built upon. So that was a real benefit from having them on board for this part. And to also include the participants in this research, trainee clinical psychologists first read the survey questions to review whether they found them distressing, helpful, wanted any changes before they were finalised. The debrief form that was supplied at the end of the survey contained some educational resources to enhance the bi-directional flow of research so that they also got something back from this project. We then used reflexive thematic analysis for our methodology, and had a bit of a challenge to overcome here as the 3 co-researchers were spread out all over the UK. So as Ganel mentioned, we often met online and utilised PowerPoint as a means of recording codes and themes from participants' quotes, which we found worked quite well. The results were that every one of the 79 participants requested specific teaching and experience of working with refugees. And this leads on to the implication being that clinical doctorate psychology courses should be implementing this as mandatory. Participants identified learning needs and challenges around language and cultural inclusion, and that the current socio-political climates are traumatic for refugees and actually barriers to being able to offer effective mental health support. So participants called for a need for systemic and community-based approaches when working with refugees. And it was found that lived experience working with interpreters are vital in service development and training. So there's a need for offering the systemic and community-based approaches, but balanced with clinical services, still needing to focus on improving their accessibility and equitable care. And ultimately, we found that improvements to asylum seeking processes and refugees having their basic needs met are key in improving refugee mental health. So, as we wanted to take an action based approach to this research, we have then co produced training guidelines around working with refugees, some principles, and we'll hopefully circulate these to yourselves soon after the presentation. And to continue in co-production, the training guidelines are going to be in a dynamic format so that more people who identify as refugees and specialist refugee organisations can continue to collaborate on these training guidelines to grow the knowledge base. Another output of this research was this beautiful piece of artwork you can see here that Ganel created to express her experience of the project. So I'll hand back over to Ganel now to share the meaning of this artwork in her own words.
Yeah, first of all, I have to say I'm not good at art at all, but I enjoy when I do some art. For me, it's like big large tree, and it's mean roots of hope, and this tree is symbolize of resilience, and this branch are refugees who came from different countries. They are together, they have empathy, they have connection. However, they speak different languages. Maybe they don't understand each other well, but they are together and they support each other, especially mentally.
Thank you very much. And so, yeah, this piece of artwork is come to represent our project. And the next stages of the project is hopefully working together to co-deliver training in lots of different spheres, perhaps to the Home Office, in education, in healthcare, social care, to help people to work alongside refugees. So next slide, please. So some key areas of learning for me was around the need for having reciprocal relationships, of thinking of, other than fair payment being really important, what are other ways that you can also value people's time and give back to them for sharing their experiences with you. So for example, Gunell and another one of the co-researchers are named authors on this paper, also offering to spend time working on their projects, offering job references. And I've put here another one of my co-researchers' quotes about her experience of working in this project. So she shared, "I'm very proud to be part of this. This brought some tears down my cheeks in a positive way, as I never saw this being part of my future, but I'm very happy and humbled that you consider me to be part of this work." And this is because as refugees, very little is heard from us, and at times it feels like we are not worthy to be part of the system. From the bottom of my heart, thank you. So a few of the co-researchers shared that being involved in this research helped bring some buried trauma to the surface in a way that allowed space for their words and a method of release through helping others and making change. So that was a real learning for me, the power of co-production in research being therapeutic for some people. So next slide, please. So thinking about taking a transculturally trauma-informed approach to working with co-researchers is going to be important for any population that you're working with, as anyone may have experienced trauma and everyone will have varying transcultural interpretations. So, for example, discussing expectations of your relationship from the beginning, so what's expected from them throughout the project, so they can make an informed choice. Thinking about how best to work with interpreters if needed, discussing their means of support if they do find material distressing when it comes up, so perhaps thinking about briefing, debriefing setups. Also, a need for being consistent and reliable wherever you can, and openly talking about how each of your personal cultural interpretations and experiences might be shaping the research, because everyone will be bringing varying interpretations to the table. So it's helpful to be curious in trying to understand one another. Next slide, please. So practical tips I found helpful for co-production include organising payment before the work starts, to avoid what can happen in research of people sometimes getting paid a long time after they've been involved. I was able to pay people immediately after each of the meetings. Something co-researchers fed back as them valuing is that I tried to be quite flexible around their availability and times. And I try to think of ways how to save their time. So, for example, completing some of their basic demographic information I had access to on administration forms, so that they had to spend minimal effort completing admin tasks that they didn't get much value from. Also making sure that they made a note of time spent outside of direct meetings on the research, so that they were paid for all of the time spent on the projects. So really throughout all of this is a theme that you're trying to find ways to value their time as much as your own. So personally for me, working with co-researchers has brought this project alive. It's added a richness, depth and detail that I'm very grateful for and would not have had without them. So Ganel shared a bit of her experience earlier,
Yeah,
but if you want to add anything else here
yeah,
about your
just
experience.
yeah, it was like very flexible, and we sometimes meet online. We discuss things and sometimes change editing. Yeah, it was really good experience for me, and thank you. Yeah, I really appreciate to be part of this work. Thank you.
Oh, wonderful. Thank you so much. And the last thing that I wanted to invite people to do, I think we're a bit pressed for time, so perhaps this is something people could do after. But it was just to write down a sentence or two on how, in your own role, whatever that might be, you plan to take the first step in engaging some more public involvement. So just a bit of a kind of promise to yourself to take another step there. Thank you very much.
Thank you to everyone that's helped with the presentation. I'm aware that we've run over. We knew we were, but we're very happy to stay on and take questions. The last slide is just to share with you our contact details if you want to get in touch or learn more, have a look at the testimonial video. But as you can see, it was very much a group effort in this presentation, which is emblematic of the whole project, really. And the fact that we've run over is also emblematic because we also run over the project, because we know that doing trauma-informed work takes time, and that there is a real importance to doing slower research when you're working with people with trauma. So we've obviously embodied that in this presentation today, and thank you very much for listening. So we're very happy to take some questions now.
Sorry, I was on mute then.
I'm sorry, Dawn, I wanted. Oh, and apologies for not moving the slides on when Hoayda was speaking. I was waiting for her to tell me.
No worries. I just want to say thank you to everybody, all the speakers today, for a fantastic presentation. It's really interesting. I'm just going to run through the Q&A now. So we've got a few questions here. Experience-based co-design requires patients, carers and public involved at a pre-formative stage of design as equal partners. Were patient, carers and public involved from the start or added at a later stage?
They were involved from the start at all stages of the project, yeah. In terms of setting the priorities, helping us think through how we do the discovery phase, which is where we learn about people's experiences. We changed our we changed our language, we changed our title, we changed our name, we changed the way we did things. They've been embedded throughout, yeah.
Thank you. And what are the primary and secondary research questions? Were they researcher-led or co-designed with lived experience partners?
I'll answer that question because I'm probably the only person here that was here from the very beginning. As I said, when we met before the project was funded, we met with the community and they brought 2 areas of priority for us, which was working with interpreters and refugee and asylum seeker mental health. We took forward one of those topics to build the proposal. The proposal was built, I led the development of the proposal that was submitted to NIHR, but that proposal was co-produced with people with lived experience, and that involved the research questions.
Brilliant, thank you. PPIE members funded by NIHR offered payments for involvement. Any problems with refugees with right to work to be paid at NIHR rates? Do you exclude any refugees without the right to work? Same for asylum seekers.
To prevent me from carrying on talking, I'm going to hand over this question to one of the team, maybe Wen-Yu.
Yeah, so we did consult NIHR's payment guidance. So I think PPI's work doesn't count as work. So we based on it's from the guidance of NIHR, and we pay people by sessions. So we have also a payment guidance of how much time they involved and how much money. And then most of the time we have choices of vouchers. We can also pay people by cash, but with people who have constantly involved, we would try to avoid paying cash because of all the different implications of income and payment. Yeah, I think that's probably what I can answer.
Yeah, no, that's great. Thank you. Peer support workers should tend to have lived experience of having been an asylum seeker or that of a refugee to be able to perform the PSW role. I think that's the question. And yeah, that's right.
Yes, yeah, absolutely. 100%. And that came from the co-production group, but it came from the very early engagement that people told us they wanted to be supported by people in the community that understood their experiences, that they could recognise, that they would be able to build trust with, and that was the beginnings of the idea of the project, really. Yeah.
Yeah, thank you. How was the digital literacy levels of the target audience?
Digital literacy is very good generally amongst refugee and asylum seekers, obviously in their own languages. As part of the project, participants were provided with a telephone and a contract to enable them to stay in contact with us and contact each other to establish social networks. We did have a very generous budget that was costed in advance to enable us to translate a range of different languages and a range of different materials, whether that be digital or paper. So that certainly enhanced the engagement on the kind of digital side of things.
Yeah, thank you. How will progress be tracked and measured? This includes progress towards achieving the desired outcome for service users and service systems and the process itself, looking at what is and is not working from different perspectives, including openness and capacity challenge.
So we didn't really go into a huge amount of detail about the feasibility trial, but the feasibility trial ran for 9 months in Plymouth and we're still running it in Gloucester. It's a mixed method evaluation framework with a process evaluation, which involved qualitative conversations with service users, peer support workers, through focus groups and interviews, providers in the mental health space and other NGO providers. We also then implemented the evaluation framework of measures, which included the WebWEMS, which was translated into different languages, social connectedness scale. We captured stigma around mental health through the qualitative interviews. And we asked service users to tell us the type of service utilisation that they were engaging in through the project. So we have baseline and measures throughout the 9-month trial at 3 intervals, which will be capturing the outcomes and processes of the feasibility trial.
Brilliant, thank you. Was this research project focused on female refugees? How does it support male refugees and people with severe mental illness?
We made the choice to include everybody and be as inclusive as possible. So we have tried not to turn anybody away from the feasibility trial. Similarly, for the co-production, we tried hard to recruit both sexes. Sorry, what was the second part of the question?
Oh, bear with, I've just popped it into the answer. So how does it support male refugees and people with severe mental illness?
So peer support work is offering low-level mental health support in the community. We work very, very closely with our NGO and service provider partners so that people with severe mental illness are referred to the Refugee and Asylum Seeker Mental Health Service. So peer support workers, a lot of the work is around the development of the model has been about how do we protect the peer support workers, you know, upskill them and provide them with that ongoing mentoring and support, but they're not designed as clinical interventions to deal with severe mental illness. That's for the Refugee and Asylum Seeker Service.
Yeah, thank you. How does the research support families?
I'm going to hand over to another member of my team so that my voice doesn't dominate. Hoayda, would you like to take this question, or someone else? Maybe Amani, because we haven't heard from Amani yet.
So yeah, hi. So the question is how we can help the families.
Yeah, how does the research support families?
So it just depends the kind of help. For example, if the families is coming to be as in workshop, or the families is trying to us as
When you're providing peer support.
Okay, so families that regarding the kind of, so someone is looking for some service, so we provide a service, how we can guide them, how they can dealing with that one. And for family, if they have children, for example, most of families asking for entertainment for the children, activities. So our job just to guide them how they can go to these places, how they can complete the form. As you know, most of family, they have children and they don't know how they can communicate with the schools, or how they can dealing with the problem with the children, especially if they have circumstances as displacements and placements, sorry, and come to here, they don't know anything around them. So that our job with the families if they have children. If they don't have children, most of them looking for mental health sessions, so we guide them to some activities or some organization around us and show them how they can link and contact or go to them.
Excellent, thank you, Amani.
Welcome.
Hoayda mentioned the questionnaires she used, but very quickly, could we hear these again?
Hoayda, do you want to talk through this?
Yeah. So we used a few of the already existing questionnaires. We used the Duke UNC Functional Social Support Questionnaire, the Challenge Sense of Belonging Scale, the Self-Stigma, of Psychology Health Scale, the WIMWeb's short version scale, the Brief Resilience Scale. These were presented at the workshop number 6. We talked through the questions, and the participants, contributors went through these questionnaires, commented on how the language of these questionnaires were. Some of these questionnaires were already existed in different languages that we needed. We have contributors from who spoke different languages, so we provided these. Yeah. Does this answer the question? I think these are the ones we use at the workshop. Yeah.
Brilliant, thank you. Were all the participants adults, or were young people under 18 also involved?
They were
All adults.
All adults, thank you. 2 more questions left. So did you have any kinds of social media to engage asylum seekers and refugees, and if so, how?
I'm going to ask either Hoayda or Wen-Yu to pick up that question.
So I think we use face-to-face engagement mostly, and we do use our phone communication when we get in touch with them and get to know them.
Thank you. And the last question is, we have over 100 early 20s males here on their own. What will keep them occupied? It's quite an open question there.
It's a really good question, and we were very lucky enough to have a male peer support worker in each site, and both of them actually have been very productive in bringing the males together and doing group-based stuff with them to establish almost like a kind of community, a small community, a small network of males that can start to create a self-sustaining group, friendship group. But it's true that many of the young male asylum seekers and refugees are often the ones that are most vulnerable because they, for all sorts of reasons, they are heavily discriminated against. And with parents, they can access social activities through their children and through schools and so on. So they can become very isolated. And this is definitely an area for future research that we will be taking forward. But I think having both male and female peer support workers is really important because it means that you can kind of reach out and make sure that you engage with all sectors and all different demographics within the refugee and asylum seeker population.
Brilliant. Thank you, Helen. Okay, that's all of the questions. So next slide, please. Thank you again to everyone for joining today, and thank you to our brilliant speakers. I just wanted to signpost everybody to the next upcoming events. So we're doing a series 2 of these webinars based on feedback from the previous evaluation forms that were sent out. So there's one on the 2nd of July and one on the 19th of September, and further details will come out about those with the invitation shortly. There'll also be an evaluation form for today's webinar, and would be forever grateful if you would fill that in and return it to us. That will be sent to you via an email with the recording and the slides after today's webinar. So thank you, everybody, and thank you for your time. Bye.